Clinical trials have recently experienced deaths of patients during tests in Africa, and medicine regulators, research ethics committees, the pharmaceutical industry, and doctors are doing some serious soul-searching whilst looking for a solution to communicating with patients with low levels of literacy. To ensure the safety of clinical trial participants, a small NGO, the South African Depression and Anxiety Group, together with Pfizer and with the collaboration and endorsement of both SAMA and the Steve Biko Center for Bioethics, have developed an innovative patient education tool, a speaking book called What It Means to Be Part of a Clinical Trial.
Most of our patients can't read, so speaking books help them to understand more about the clinical trial.
Our patients are vulnerable in that there's really high levels of poverty and very low levels of literacy.
It explains in very simplistic terms to someone who is illiterate what it means to participate in a clinical trial, your rights and obligations, what you need to do and what you must not do when you're participating in a clinical trial for your own health, and also not to jeopardize the outcome of that clinical trial.
So it helps them to understand more about the trials and how they can take care of the medication and so forth.
We give the patient this book to help them.
High levels of illiteracy in rural communities and women make it difficult for written information provided to patients to be fully understood.
As you want to, at any time. Taking part in the study is your choice. No one can force you, and you do not have to agree. It's the study doctor's responsibility to make sure your life, health, privacy and dignity are protected.
Using simple technology, the speaking books include 16 sound buttons which activate a short voice recording that reads the text of each page in the book, making even complex, hard-to-understand messages accessible to people whose literacy skills are limited and access to other educational aids restricted.
The book, in fact, is very, very, very easy to understand in that it addresses the principles of ethical practice in clinical trials, meaning, the right to dignity of a person, beneficence and non-maleficence, and also the issue of distributive justice.
Information disseminated in this form empowers patients and protects the participants' human rights, which is of paramount concern to all stakeholders. Even those who cannot read are now able to make an informed decision about whether or not to participate in a trial. Through the free distribution of the speaking book, patients are able to take responsibility for their health and take a proactive role in their trial. The key to the success of the speaking book is that the information is seen, read and heard, therefore providing an effective tool that empowers low literacy communities and enables them to gain knowledge and insight into clinical trials. The speaking book, What It Means to Be Part of a Clinical Trial, is testament to the industry's commitment to solving the problem of effective communication with low literacy patients.
I'm happy with this book. It gives me the knowledge and it gives me the allowance to talk to my doctor and the freedom.
The speaking book empowers the population, empowers the individual to understand his or her rights and responsibilities when it comes to clinical trials.
In time, of course, we hope that we can translate the book into indigenous languages. It will make even better sense when the patient listens to the speaking book in their own mother tongue.
I love the book. It makes me understand the book.
I was very scared to be part of the trial. Now I'm so happy with this book because this book allows me to understand.